Good morning and welcome to the Global Health Press interview with Dr. Zamberi on COVID-19 in Malaysia today. Dr. Zamberi is a professor of medical microbiology in Malaysia, and I am Joe Schmidt, editor-in-chief with Global Health Press in Singapore. Now, as a background information, I would like to start with saying that the pandemic with COVID caused a dramatic loss of humans' life. 32 million people probably died. The economy experienced huge losses. The GDP fell by 3.4% in 2020. Educational institutions had to close and had to shift to remote learning. There was a lot of disruption in the education. Vaccination programs imploded. And as a consequence, today we currently see disease outbreaks, like outbreaks with measles, for example, in Vietnam. We have 80,000 cases so far in 2025 alone. With that in mind, I asked Dr. Zamberi, what is the current situation with regard to COVID-19 in Malaysia?
Thank you, Professor Smith. Yes, in Malaysia, actually, when you talk about the pandemic, since the pandemic until now, there are about more than 5 million cases. 5 million cases and about 37,000 deaths. So not too bad in terms of the percentage of the mortality rate. But from 2025, this year, we are looking at number of 11,700 cases. And so far, there were no deaths reported. So we are also aware that there's an increase in cases in Thailand and also Singapore. And so our Ministry of Health is a bit on the high alert on the surge in cases. But at the moment is controllable.
So there is still disease around. The question then would be, how is the perception in the general population? Do they perceive COVID-19 as a dangerous disease? Are they willing to get vaccinated? Are they afraid that there is still a threat? Or what is the perception in the population?
Yeah, at the moment, it seems that there was, if you based on newspaper reports and so on to reflect the public perception, there were no highlights about increase in COVID cases or COVID surveillance anymore since 2025. So my guess is the perception of COVID-19 as a serious disease is not there. Probably, I think people tend to forget about it, that the past few years we have been suffering a lot due to COVID. And now we see that what measures has been implemented before, such as social distancing, wearing masks, is getting less and less. Seldom see people wearing masks now. So here you can say that COVID is no longer a crisis. I'm sure some people also look at it as like a seasonal flu. But in terms of the acceptance of vaccination, there is very high level acceptance, as you can see previously. But in terms of if you want to get the public to get vaccinated now, in terms of urgency, in view of the increasing cases, I don't think there is this sense of urgency to get the vaccine. But bear in mind, MOH, our Ministry of Health, is doing a lot of surveillance on this to monitor the situation. As you know, there is at the moment no need for panic because the deaths, there were no deaths. So most of the cases are mild, but of course some are hospitalized.
Yeah. So most cases are mild. In other countries, there are risk groups for whom vaccination is recommended, those who still do have a risk to die. Are there such recommendations, or what are the vaccine recommendations in Malaysia?
Yeah, the recommendations are there on paper. I mean, in terms of the recommended vaccination schedule for high-risk groups such as elderly, those with comorbids, and so on. These are the usual that we have recommended since the beginning of the vaccination program and so on. But now, when you talk about getting people to be vaccinated, honestly, I can say that that would be a big of a challenge for us to see in terms of getting the vaccine. For the public, where are they going to get the vaccine? So that was not being publicized. Where to get a vaccine? What was mentioned was that there is an app. The app was previously used to get an appointment to get the vaccine. So for them to go to the app and look for the location of the hospitals and so on, which has the vaccine, so that is a big challenge. So I can say that the recommendation is there, but in terms of the implementation, just in case that there is a rush for vaccine, that's remained to be seen.
So that makes me believe that vaccine uptake is low,
Yes,
even for those who may have a risk.
Yes, if you're talking about the current context. But of course, more than 80% has been vaccinated previously, including myself, was taken like a few years ago. So it need to be seen whether that particular protection is still there. But at the moment, it seems that whatever vaccine we've taken last time is still very effective in terms of containing the serious form of the disease, because we are seeing more and more mild cases. Of course, the viral evolution also plays an important role there.
Are other vaccines recommended and used for risk groups like influenza or pneumococcus? Are there other recommendations in place?
Yes, we do have recommendations for influenza and also pneumococcal. Again, the uptake for Malaysia in terms of flu and also pneumococcal vaccine is quite low.
Okay.
I can say that the emphasis on adult immunization is less compared to children. So
yeah. Would you happen to know which vaccines are used, if they are used for COVID, pneumococcus influenza? Is there co-administration? Can you embark a little bit on the practice of vaccination with the pneumococcus influenza and COVID?
In terms of co-administration, yeah, of course, some patients do ask for it, but majority won't. They prefer to come another day to get the vaccination, probably because the confidence in terms of getting two vaccines at the same time is less. But evidence says there's no harm in getting two vaccines at the same time.
Okay, so this is the preference of patients is to have separate vaccinations. Okay, now finally, besides vaccination, there are policies and there are other ways to prevent infectious diseases like quarantine. What is in place in Malaysia at this point? What other policies exist?
At the moment, in terms of quarantine and so on, the government has said that this is a personal responsibility. So they have to do it themselves. They have to self-quarantine rather than a regulation saying that, you are positive and then you need to be quarantined at a facility. So it's all, the onus is on the person itself to get themselves to be quarantined.
Yeah. It's a little bit like in other countries where you have the disease. In the past, if you have a common cold, you did or did not stay home. Most people went back to work, right? And with COVID, if you had COVID, you stayed home. And now it's probably back to normal. If you have mild COVID, you still go to work, right? Because you need the income.
Yeah, one thing I noticed here compared to previously before COVID is people know that is his or her responsibility to wear mask, even though they have these respiratory symptoms with the runny nose and so on. So they come to work, they are wearing masks, saying that okay, I'm having this mild infection, so that's why I'm wearing mask, not to infect you. That was not there before. So this is a good thing that in terms of health education and infection prevention that we are seeing.
So people did learn something and have some attitudes from the COVID pandemic brought to current times.
Yes.
Thank you very much. Thank you very much, Professor Zamberi, for the interview and for the information you provided. Goodbye, and hope to talk to you again very soon. Bye-bye.
Bye-bye. Thank you for having me. Thank you. Bye-bye.